My name is Dawn Grosser. I grew up in Kansas City, Missouri. I am a Midwesterner at heart, but I left when I was 18 to come to Texas and go to Baylor. Studied pre-med courses, which consist of the sciences, and I majored in religion. And a big reason for that was that Baylor encouraged classical education, and religion was something that really interested me. And I even considered going to seminary at one point, but medicine won out. I continued after Baylor for 2 more years working at a place called the Church Health Center in Memphis, Tennessee. And they helped with patients who were impoverished and needed more medical care and other resources, so I worked with them. After those couple years, I went to medical school at Yale New Haven, Connecticut, and then stayed on for residency. Didn't enjoy the snow, so my fellowship, I ended up at Scottsdale, Arizona at Mayo Clinic and did a fellowship in foot and ankle there. And then after that, I came back to Texas to do foot and ankle with a group of 8 down in Corpus Christi. There wasn't any foot and ankle when I came, and there wasn't any female orthopedics, which is not uncommon, but it was a great time to be there, and I really enjoyed the practice and the patients I had. And for 13 years, developed rapport with the medical community and the patients, and it was hard to leave, but I came to Dallas in 2019 at the end of the year to join this wonderful group. Foot and ankle, there's a lot that I keep learning about it and that I enjoy and keeps me on my toes. I tend to have a more conservative approach. There are certainly things that have to have surgery in order to walk again or to be able to be mobile, but there are a lot of things that don't require surgery, and there's a lot of gray. And so I feel like I tend to talk to my patients about their options. Some of what we do is not surgical, but maybe a little more invasive, like injections. There are supplements, different topical medications, diet. We have to figure out the right approach for activity. And so that's also part of the conversation if it's needed. Something that really affects how I view patients, how I practice medicine, and really who I am has to do with my mother, who, when she was 6, contracted polio. And she survived the iron lung, but was in a wheelchair for the rest of her life. And thankfully, she was stubborn enough to not listen to her doctors and had a baby, so I am lucky to be here. But as a child of a disabled person, as a caregiver, and as a child who is often an extension of their parent, I truly have an empathy, not just a sympathy, but an empathy with what disability means. Much of my patients, thankfully, it's only a temporary disability. There are so many things that not being able to use your body the way you'd like to and the way it's meant to be used are hard. I also grew up going to Warm Springs, Georgia, where many post-polio patients went to rehab, like FDR. And they specialized, they had wonderful orthotists there, and they did all kinds of bracing and orthotics, and I went with her, watched them make these braces for her, and I feel like that has also informed my practice too. I helped my mom after surgery, when she had orthopedic surgeries, recover, and I know what that's like. Understanding of what a person goes through with a disability, and what a fighter she was, and how so much truly can be achieved with the right attitude and approach. And so I try to maintain that and what I learned from her, and also bring some of that to my patient and the interactions I have with them.